Hello everyone and welcome to a new video. My name is Kyle and I'm a second year DPT student, and I thought I'd take some time today to outline exactly how you can have a great first clinical experience no matter where you are for your first clinical placement. Today I will be talking about communicating with your clinical site, what to bring with you on that first day, as well as what content might be useful to review for whatever population or setting you'll be in. If you're looking for more detail on exactly how to have a really successful clinical experience in your population or setting, make sure to watch out for a new series I have called DPT Clinical Survival Guides. But for now, let's get into how to initiate contact with your clinical site. Now for this, your school may have outlined exactly how to approach this, but if they're missing some of the things that I show you in here, make sure to include them as well, because they can be useful information just to make sure you're really prepared for that first day. But let's just talk about it. First thing is to make sure to tell them within the email what your name is, why you're contacting them. Say for example, you're a student going on clinical starting on this particular day, so that they know that their dates are actually lining up and you can really clarify and make sure that your clinical site and the school are on the same page, as well as mention your progress in school. This will give the site as well as your clinical instructor a good idea of what content you've covered so far. And then if you feel like it might be useful to mention when you'll be in town, if you have to move or go to a different location for this. That way, if they want to have you in for a tour or anything to help you feel like you're more comfortable at the site, they can have an idea of about when they can have that initiated. Now, once you tell them this information, you want to then make sure to ask who your CI is if you don't know yet, because sometimes you're only given the contact information for the site specifically, so this is a great opportunity to move in and ask that question. But outside of that, you want to see what populations your clinical instructor works with, what their schedule is, as well as what actions need to be done before you start and when. This is also a great opportunity to communicate exactly what you've done so far for the onboarding process, so that way they know that you've submitted those items and can double check that they have actually received them. Then you want to clarify exactly what the dress code is. For the most part, inpatient acute care, inpatient rehab, SNFs are most of the time going to be in scrubs, and outpatient sometimes is in scrubs, but most of the time is going to be kind of your classic polo, khakis, maybe some athletic clothing, so just make sure you clarify with them. Outside of that, see if they need you to bring anything specific. Ask any recommendations for driving or parking in case some things can get complicated for your site, as well as ask for recommendations on content to review before you begin. Because later in this video, I'll give you a good idea of some general concepts to just make sure you're comfortable with, but they may have a particular set of individuals that they work with frequently that they really want you to be familiar with, so it doesn't seem as much of a shock when you get there at first. As for what to bring with you to clinic, this will kind of depend on how they respond to your question in your email, so make sure that you do adjust it based on what they say, but here's just kind of a general list of things that I have found are useful to bring just in case. Now, some of the basic things that you're going to want to have with you are going to be have a water bottle that's full for you throughout the day, as well as make sure you have your lunch and some snacks. Depending on your clinical instructor's schedule, you may have some weird hours that you only get a lunch and you might get hungry after going for 12 hours long, so it's useful to have some of those kind of pocket snacks in case you're really getting hungry during those first couple days that you're getting used to the schedule that you're working on. Now, along with this, make sure that you have a name badge with you. This can be one that you have custom made. This can be your student ID badge, just something that helps the patients be able to identify you and get to know you better. On top of this, I find it useful to bring my laptop or tablet with me. That's because that's where I house a lot of the notes that I have from classes, so it's just a good reference to have in case I need to look at something in between patients, just to make sure that I am on the right page of where I'm going with treatment. But if you're someone who is just looking to make sure you have some notes, you can always bring your tablet, or if you prefer, bring some paper and a pen or pencil. If you do the paper and pen or pencil, I would suggest bringing a clipboard along. One of the useful ones that I found, and I was lucky enough to receive as a gift from my clinical instructor, was this clipboard that I'm showing on screen. It's extremely useful because it has lots of the basic information of myotomes, dermatomes, some of the basics of pulse strength. Everything that you would really need in a pinch is on there, so I would just suggest it so that you can make your notes anywhere and you aren't constantly looking for a surface to be able to write on and can be right there with the patient. Now, when you're thinking about content to review before you start your clinical experience, I'd make sure that you understand what population you're in, as well as maybe if you know that your clinical instructor is going to mainly see lots of total hip replacements, then you might think of what are the main surgical precautions post-op that you want to keep in mind for your population that you're working with. Or if you're in pediatrics, make sure that you know what are the developmental milestones at each age. So make sure that you know your population and maybe review some of the material that's regarding exactly what your clinical instructor has informed you about. Outside of that, there are some general topics that I think are really useful for anyone wherever they're going, so I'll talk about them right now. Now, one of the first things you're going to want to look for is the red flags, some of the really important sinister pathologies that you want to be able to identify and know that it's out of your scope to make sure that they get to the care that they need. These are things such as cancer, Cauda equina syndrome, being able to identify fracture. So having those things in your tool belt is going to be really important, even if you don't use them all the time. Second is going to be reviewing exactly how billing codes works. So think about the time that you need for Medicare. Say to get 1 unit of a code, you need between 8 and 22 minutes, and being able to know how to adjust based on the duration of your session, kind of looking at some of the basic codes you might be billing so you have an idea of when your clinical instructor asks you what you would want to bill for this patient, that you would be able to provide that reasoning. On top of this, it's always good to know some of the basic ranges for vital signs such as your respiratory rate, your heart rate, and your blood pressure. Those are always going to be useful. You don't always take them depending on the setting that you're in, but it's at least good to know no matter what. The last thing that I think is important is just taking some time to practice your subjective history taking. This can be just talking with some friends. You have some classmates who will give you a case that they'll just kind of walk you through. Think of some questions that you might ask them about, say, their home environment, so that you can really apply what you're working on them with to exactly where they're going to go from here and things like that. So just kind of give you some time to think about your population and what might be important to them. While this video takes a general approach to preparation, as was intended, I hope it gives you a good place to start before your clinical experience begins. If you want to know exactly what questions you should make sure to ask your clinical instructor on day one to ensure that you have a successful start, check out my video on it to give yourself a kickstart at the beginning of your clinical experience. If you enjoyed this video, please make sure to like and subscribe to see more videos just like this one, as well as others related to DPT school. Thank you so much for watching. This has been KB DPT, and I'll see you all in the next video.